My loved one has schizophrenia. There are good days and there are bad days. Is there a permanent cure? Good morning, everyone. My name is Dr. Parth Goyal, and I'm a consultant psychiatrist practicing in Ahmedabad. My core interests are adult psychiatry and neurostimulation. In this video, I would like to talk to all those patients and their caregivers who are suffering from schizophrenia. This video is not an introduction to schizophrenia. It's addressing a problem that most patients and caregivers with schizophrenia face over a long period of time. Schizophrenia is a prototype of mental illnesses. It is one of the most commonly recognized mental illnesses. In fact, it is almost synonymous to psychiatry. As most of the people suffering from schizophrenia know, schizophrenia is a lifelong illness. Schizophrenia as an illness has ups and downs. There are periods when the symptoms can increase significantly, and these symptoms can be very distressing. These symptoms can be very disturbing. And then there are periods where these symptoms can completely subside. There would be months or days or even years when the patient will not have any symptoms, even without being treated or without being given any medication. This state creates a lot of confusion in the minds of the caregivers. I have a lot of patients and their relatives coming to me and asking me, is this really an illness? There are days when he's absolutely fine. There are days when he's just not okay. Is he faking it? Or is this really an illness? The second question they have is, if it is an illness, can there be a permanent cure to this? And the third question that they have is, even when he is on medication, he is not always normal. Not all symptoms go away. And most importantly, even on medicines, he does not live a normal life. He is not independent. To answer some of these questions, I want to make this video. Let me start off with helping you understand what schizophrenia is. Schizophrenia is a chronic, that means long-standing illness, which is lifelong in nature. That means once you have diagnosed somebody with schizophrenia, the diagnosis tends to persist for a lifetime. However, schizophrenia is an illness which has a lot of variations built into it. That means there can be days and months when the patients can be very symptomatic, can have a lot of symptoms, and the symptoms can be very troubling. And then there can be days and months and years when the patient is absolutely asymptomatic. The patient might not have been given any medicines, and yet the patient might recover. So if the illness has ups and downs, the question arises, why should we treat the illness? The reason we have to treat the illness is, if the illness is left untreated, these normal periods of no symptoms reduce, and the period where active symptoms are present increase. The number of symptoms will also increase, the severity of symptoms will also increase, and some of these symptoms can become very difficult to manage. Example, when the patient is feeling persecutory in nature, when the patient is feeling that he is being targeted by other persons, when there is predominant paranoid delusion, the patient can become excessively aggressive, and that aggression can come out on either family members or whoever he thinks is responsible for targeting. Thus, in order to, one, reduce the symptoms, treatment is required. Second, in order to keep the symptoms in check so that future episodes do not happen, treatment is required. And most importantly, in order to enable the patient to live a normal life where he can live normally, he can go to work normally, get married, have kids, live a normal functioning life, treatment is required. Coming to the second question, is there a permanent cure to schizophrenia? Schizophrenia is like any other chronic illness, for example, like diabetes or hypertension, which can be managed but cannot be cured. There is no permanent treatment to schizophrenia, which once given does not need to be repeated again. The mainstay treatment of schizophrenia are antipsychotic medications, which need to be given regularly to keep schizophrenia in check. To explain the reason in brief to you, the reason is schizophrenia is caused because of an increase in dopamine levels in the brain. Currently, we have no way to reverse this increase in dopamine levels. The only thing that we can do is by using antipsychotic medications, we can prevent this excessive dopamine from acting on brain cells and causing active symptoms of schizophrenia. Just like in patients with diabetes, where we do not currently have a way to reverse diabetes, oral anti-diabetic medications or injectable insulins are available, which reduce the impact of diabetes in daily life. Similarly, antipsychotic medications are available, which reduce the impact of these symptoms on daily life and help the patient to live a near normal life. So, having said the fact that schizophrenia cannot be permanently cured, it does not mean that schizophrenia cannot be successfully managed. Most of our patients with schizophrenia live a near normal life they have a job, they get married, they have kids, they have a good active social functioning. Most of them, if you would see, you would not even know that they have a history of schizophrenia. So, to conclude my video, the thing that I would like to say is having good days and bad days in schizophrenia is the natural course of the illness. We try to reduce these bad days by using antipsychotic medication. Currently, there is no permanent cure of schizophrenia, but there are absolutely amazing medications that are available which reduce the impact of schizophrenia on daily life and help the patient live an absolutely near normal life. Thank you for watching. Hope this helps.